Hey y'all, and welcome back to my channel. On this page, I talk about technology, money, health, wellness, and any other topic that I come across and find interesting. If you are new here, consider subscribing to my channel. And if you find the information in this video helpful, like the video and share it with your friends. Thank you. So in today's video, I wanted to talk about 3 bedside nursing skills that you use and can carry forward in your work as an informatics nurse. I love hearing from you guys. I love when you email me and you ask questions about what is it like working as an informatics nurse, what do you do, the type of skills that you use, or the type of skills that I know some of my colleagues who are also informatics nurses use. And so when you ask questions like that, sometimes I'm finding it easier to create a video based on the type of questions that you all ask me that can help others. So this video is to get you to start thinking if you are a bedside nurse or if you're a nurse in another specialty and looking to consider switching it over to informatics, just to kind of get you thinking, you know, these are the skills that I do all the time that can then be carried forward as an informatics nurse. So this list is not inclusive. But it's just more so of like an encouragement and an empowerment to get you thinking. And also, I like to say some of what you need is already inside of you. You're already doing these skills that I'm going to talk about. If you've been a bedside nurse for amount of time, you're already doing these skills. So you can take those skills and then and carry them forward to your work as an informatics nurse. This is also a follow-up to my last video, which I will link above, on 3 soft skills that are really helpful as an informatics nurse. So the first skill is communication. So I can't not underscore this skill enough. So think about when you're a bedside nurse and you may be talking with a patient about their diabetes condition or situation. You talk to that patient about their condition and you can take that same information and communicate it to a family member, to a provider, whether it's a physician or a nurse practitioner or a physician assistant, to also your teammates, like your fellow nurses. You're giving the same information to those different people, but you are delivering it in different ways. So as an informatics nurse, you're doing the same thing. You can be talking with your customers, which may be nurse leadership or other bedside nurses, or you may be talking with software vendors or your other technical teammates or even technical leadership, and you are giving those individuals the same information, but you are communicating that information to them in different ways. So that is definitely a skill that bedside nurses do. You're able to take information and package it in different ways and deliver it to different people, and you do the same thing as an informatics nurse. So that one is very important and you're already doing it. So the second skill is juggling multiple priorities. So, and not just juggling multiple priorities, but also being agile and nimble enough to shift your priorities based on new information. For example, as a bedside nurse, you may be hanging an IV, you may be discharging a patient, you may have to document a med pass, and don't let a code happen in the middle of you doing some work, but you are agile and nimble enough based on new information to shift your priorities. So as an informatics nurse, you do the same thing. Now, you may not have to run to the code in the middle of a shift or in the middle of doing something else important, but as an informatics nurse, you're still having to juggle multiple priorities and being nimble to shift your focus at a moment's notice. So you could be in the middle of doing some testing of some software and doing some quality assurance checks. You could be running a meeting or participating in a meeting. You could be working with the vendor, and then all of a sudden, perhaps your software application crashes, or there's a cybersecurity event. So being nimble and agile, the nimbleness and agility that you have as a bedside nurse is definitely a skill that carries forward and serves you very well once you become an informatics nurse, because we're always getting in new information and having to shift our priorities in the middle of a day, sometimes in the middle of an hour, and still getting the work done. And speaking of getting the work done, the third and final skill for this video that bedside nurses, you do it all the time. You may not think about it, but it's definitely a very valuable skill. And that is working with difficult and different and sometimes challenging personalities. Now, you may have a patient, a family member, a fellow teammate, a provider. You may have these different people that you're working with that have personalities that are challenging, that may sometimes make getting the work done a little difficult, but there's still work to be done. There's still a patient that needs to be cared for at the end of the day. Same thing as an informatics nurse. You may be working with a challenging coworker. You may be working with a vendor with a challenging personality. You may have a leadership person with a challenging or different or difficult personality. And it may even be more so challenging if you are new to technology or a new informatics nurse, if you're a minority, or if you're a woman. People may try you, and you may have days, especially when you get started, that may be a little bit difficult, but you still have to, the work still needs to be done. You know, there's not a patient that you're laying hands and caring for, but there is still a software application or a clinical software that needs to be worked on or updated that has a patient at the other end. So you're still taking care of patients. So you may be working with a challenging or difficult personality, but you still have to get the work done. And being able to do that and get along with people and finding ways to work with different types of personalities, the same thing you do as a bedside nurse, that same skill carries forward and serves you well as an informatics nurse. So yeah, that's it. Those were the three. And again, I wanted to say that list is not all inclusive, but if you are an informatics nurse, or if you're a bedside nurse and you have some other skills you're curious would carry forward and serve you well, I would love to hear from you. I love hearing from you guys. You can leave a comment below. You can email me. And again, consider subscribing to my channel and liking and sharing this video if you find it helpful. And I will see you in the next video.